We mentioned earlier the recent report documenting the health crisis in Venezuela and describing the health system as one in utter collapse. Tamara Taraciuk Broner is one of the co-authors of that report. She's America's senior researcher for Human Rights Watch, and she spoke to us from Colombia, where so many Venezuelans have sought refuge from the dire situation at home. When you describe the health system in Venezuela as a system in utter collapse, what do you actually mean?
Well, we've documented a situation that is extremely worrying. We are seeing outbreaks of preventable diseases such as measles and diphtheria. For example, if you take measles, there were no recorded cases of measles in Venezuela for nearly a decade, except for one in 2012. And since the outbreak began in mid-2017, we are seeing more than 9,000 reported cases and more than 6,000 confirmed cases. There are also spikes in the cases of malaria and tuberculosis, and the number of patients with HIV that do not have access to antiretroviral treatment is of 9 out of 10. So every 10 Venezuelans with HIV, 9 do not have access to medication that is life-saving.
I was going to say that's the other issue, right, is the access to medical care. What can you tell us about that?
Well, today in Venezuela is extremely difficult to get access to medicines and medical supplies. When you go to the hospital, you need to take your own medical kit, they call it, with the elements they need to be able to treat you. There's also an exodus of Venezuelans more widely, but that includes doctors and medical professionals. So it's harder to get adequate care in hospitals. And all of this is made much, much worse due to the electricity cuts. That also makes it harder to get access to water in hospitals.
You have urged the United Nations to take a leadership role in this and declare it officially a humanitarian crisis. The Red Cross has finally reached some kind of an agreement with Maduro and says it's going to increase its aid and get some access into the country. What do you think the UN action would actually accomplish?
Well, to date, there has been in the past few months an increase of some access by humanitarian actors, including the Red Cross more recently, but also some United Nations previously. But it is very little and too late. The only organization that has the capacity to carry out the large-scale humanitarian measures that are needed to address this crisis is the UN, led at its highest levels. And the way this would happen is if UN Secretary General Antonio Guterres officially declares that Venezuela is facing a humanitarian emergency, this is a technical UN term that would make it much more feasible for sufficient resources to be deployed to address this crisis in the short term.
Even if you can't get into the country?
Well, the truth is that we were not asking Guterres to ask permission to send an additional container with medicines. What he needs is to redouble the pressure coming from the highest levels of the United Nations so that it is the UN that leads these efforts. And the evidence that we've seen is that when under pressure, the government of Maduro responds. And, it's not a coincidence that the Red Cross access to Venezuela is happening right after a private report was leaked in which the UN was starting to look at the situation in Venezuela.
There are so many needs in Venezuela now. As you point out, it's medicine and medical care, it's food, it's rebuilding the infrastructure. What's the priority here in your view?
It's very hard to establish a priority, but one thing that is definitely a starting point is carrying out a comprehensive diagnosis by independent actors of the extent of the crisis, because the numbers we show in our report are extremely problematic and troubling, but it's just the peak of the iceberg. So one of the first steps is for Guterres to request access to Venezuelan authorities to comprehensive data that they have and have deliberately hidden over the past couple of years. And evidently, the silent diplomacy that they've chosen until now has not been effective. And that's why we're asking for a shift of strategy.
And that strategy would be, when you talk about a shift in strategy?
That strategy would be to call things by their name. This is a humanitarian emergency. Guterres needs to say so explicitly. He needs to establish that Venezuela is a priority for the UN Emergency Relief Coordinator, who heads OCHA, the Office of Coordination of Humanitarian Affairs at the United Nations, and formally and publicly require access to this epidemiological data that would allow the United Nations to carry out this comprehensive assessment and use that as a basis to carry out a large-scale operation that is necessary.
Thank you very much for your expertise.
Thank you for having me.